Hi, everyone. We will get started in just one moment. We're going to wait for our attendees to join the call. Thank you. Good afternoon, everyone. My name is Jennifer McDuffie, and I'm the Associate Vice Chancellor of Student Affairs here at CU Boulder. I'll be moderating today's call. Some quick housekeeping items before we get started. All attendee lines will be muted throughout the call. We will have question and answer, and when we get there, we ask that you place your question in the Q&A function at the bottom of your screen. We will do our best to get to all questions, and if we do not get to your question, we will post more information at our COVID-19 website at CU. As a reminder, today's call is recorded. This recording will be added to that same website, COVID-19. On today's call, we are joined by Patrick O'Rourke, our Interim Executive Vice Chancellor and Chief Operating Officer, as well as Jeff Zayak, our Executive Director of Boulder County Public Health. In addition, we're joined by Dan Jones, the Associate Vice Chancellor for Integrity, Safety, and Compliance, Provost Russ Moore, our Chief Academic Officer, Catherine Eggert, our Senior Vice Provost for Academic Planning and Assessment, Dr. Chris Urbina, Boulder County Public Health's Medical Officer, Trina Ruland, the Boulder County Attorney, and Sarah Huntley, the Director of Communication and Engagement with the City of Boulder. At this time, I'll turn it over to Pat O'Rourke for opening remarks.
Hi, everyone, and thank you for joining us for the Q&A today. We are looking forward to taking your questions, but before that, thought we would give you a little bit of a brief update. We've got some good news to report, which is that we're making progress. Last week, we talked to you about the COVID dial that gets used throughout the state to be able to determine whether or not a county is moving up or down in terms of its concern for the Colorado Department of Public Health and Environment. And we talked about the fact that if we didn't do a better job of being able to get a handle on the COVID cases that we had, that could lead to greater restrictions, both for CU students and across the entire county. The good news is that we're moving in the right direction. When you look at the key metrics that determine where you are on the dial, two of the key ones are just the number of cases you have by your population and the positivity rate for COVID testing. What we saw last week is that countywide, we were close to 400 cases per 100,000 people in the county a week ago. And as of this morning, that number has dropped down to 265 per 100,000. That's really great progress, but it's still too high. We need to go further in being able to reduce our number of cases. But you may have seen a Daily Camera article this morning that reported that in terms of being in the green to red zone, we were in the red zone for the number of cases, and now we've moved into the orange zone, but we can still need to reduce that number further. But we're making progress, and really thank everyone for what they've done to enable us to get this far. Same thing on the positivity rate. The countywide numbers were well above 5% for most of the last 2 weeks. And as of today, that number has gone back down below 5%. So what we're seeing, and I know that it's been difficult, is that what's being done to be able to protect our campus and protect our community is working. And that's going to enable us to have better educational experiences and to be able to be in a place where we're able to work collaboratively with our partners in order to try to protect the community. The numbers that we're seeing at the big level are also mirrored in what we're seeing on campus. With our surveillance testing, we're seeing the positivity rate on that continue to drop. That's down on many days, down below 2%, which is really great progress from where we were less than 2 weeks ago. We're also seeing fewer symptomatic students coming into the Wardenburg Health Center for testing, and the number of students that we have in our isolation and quarantine space has gone down. So we're definitely making progress, and it's thanks to what all of you have been doing. I'm happy to let you know that we are able to provide more services and more testing. Right now, one of our goals since we came into the fall semester was to be able to increase our amount of COVID testing. And this week we were able to expand that. We're offering an additional 600 tests per week to off-campus student, faculty, and staff. Those tests are in addition to the on-campus testing that we were previously offering. And that we know that that's a mechanism for us to be able to establish an early warning system in our off-campus community as well. Those 450 tests of the 600 will be available each day on main campus and 150 tests per day on the East Campus. Those tests are available on a first come, first served basis for all faculty, staff, and students. And we have about 900 other frontline employees who are regularly participating in our COVID monitoring program. So I'm very grateful to what the whole community has done. And I'm really grateful for Jeff Zayak, who's joined us today, and his team over at Boulder County Public Health, as they've worked through mitigation plans for us, that they've engaged in really positive discussions with being able to have the community and the state understand the efforts that we're making together. And I'm really encouraged that I think we have a chance to turn this in the right direction. And with that, I'd ask Jeff to provide his perspective.
Thank you, Pat, and thanks to everybody that's tuning in today. As Pat said, we've had really great news over the last week. Our rate of infection has dropped significantly. Even though we're not quite to safer level 2, we are moving in the right direction. And this is where I just want to take the time to say thank you so much to students. It is, like I had said last week, we can't be everywhere all the time. And it's very clear that you all have helped us get this moving in the right direction. And it's making a significant difference. So I want to thank students, parents, all of you who have worked together to help us move in the direction that we're headed. And that's exactly where we need to continue to go. So thanks. I know it's difficult and it's making a big impact, and it has significant impacts on our community as well. I do want to go back and just revisit a couple things that are really important. So we do need to continue to keep the rate down. And as long as our rates stay down, we will get back to safer level 2, which means that we won't have all those changes potentially that we would need to have to make in our community that I talked about a little bit last week. And some of those things, again, are if we don't end up where we started at safer level 2, then we have to look at potential business closures or more stringent reductions than already exist for our businesses now. That obviously has millions of dollars of economic impact in our community. It also can mean the difference between if people have jobs or not. And obviously, just as it is on all of us, it can have significant effects on people's mental health and physical health, as well as their quality of life. So the fact that you've helped us move back towards the right direction is exactly what we need. And I so much appreciate the commitment that everybody has taken, because we could not do this without everyone on this call working together. And that certainly goes for our students as well. So thank you so much. I just want to make one more, just highlight how much resource it takes and why we need to stay where we are now as we move forward. In addition to those economic impacts or potential impacts to people's lives, especially if they're in the high risk scenarios, it takes a ton, obviously, of resources for us. So for each case investigation, I think I mentioned this last week, it's about 2 hours of time per each positive case. And then for each positive case, it takes another 4 to 5 close contacts typically that we have to investigate. And for each of those investigations, it takes anywhere from 30 minutes to an hour. So if you total that up by that total number of cases at our peak per day, it turns into a huge amount of time and effort in order to try to control the spread of the disease. So we need to be diligent, keep moving forward in the direction that we're moving right now. It is exactly where we need to head. And as long as we can continue that, we will be able to start to move back to more normal environments as to when we started this. And we just need to make sure that we can accomplish that and that we don't see more spikes. So please, please continue the great things that you're doing. Again, key messages from me are, no gatherings where you're within 6 feet, social distancing of folks. Please follow the orders that are in place. We will be looking at modifying the orders this week. It still needs to go to our Board of Health, and we need to go back to the Colorado Department of Public Health and Environment and get approval from them as well. But we will be looking at modifying some of those orders as we move forward this week. And please make sure you're masking. Masking makes a difference. It can make a difference for sure in how that disease is spread. So maintaining the social distancing, masking, and good hand washing are really going to go a long way to help us maintain and stay where we're at this point and be able to continue to move forward. So thanks again to all of you. Appreciate it. And I will stop there.
Thank you, Pat, and thank you, Jeff. Those were great opening remarks. I want to share just a few things before we turn it over for question and answer. I want to also say thank you. I know that the incredible changes over the past weeks have impacted our students. We are not aware of any summons from the weekend of students who hosted large gatherings on the Hill, and our violations in the residence halls are down. Thank you. It's important that we continue to maintain these trends. We also know that it hasn't been easy for our students and our families, and some of this is unsettling and frustrating. But as a Buff family, we have remained resilient and continue to work on supporting each other. In fact, as we speak now, we're hosting our 3rd annual Health and Wellness Summit. It's completely virtual, and this year's theme is Endurance in the Face of Uncertainty. We offer presentations on relevant topics like relationships, finances, conflict, pardon me, self-care, mental and emotional health. And it's really important that this is a free, engaging summit for anyone to join. So please consider looking at that. In addition to the summit, the Division of Student Affairs offers ongoing support for students. For those who are looking to build connections, we have more than 500 events planned for you this semester. There's something for everyone. Virtual debate watch parties, art projects, bingo, book clubs, trivia nights, career development workshops, cooking classes with comedians, and more. Colorado.edu/student affairs fall events has all the information in case you're interested. For those of you who are struggling with anxiety, stress, or depression, we really want you to know that the Health and Wellness Services team is here to support you. Our counseling and psychiatric services is offering telehealth appointments and workshops to help students cope with COVID as well as non-COVID related things. Weekly events like Mindful Mondays or Health Huts or Wellness Wednesdays, or our most popular, which is our Friday series, allows for students to engage in skill building and also in community. Peer wellness coaching. is a free service available to all students to help them achieve their goals, whether it's personal health and wellness or just making meaningful connections. Our Buff Pantry is a brand new addition, and we have students at CU who are in need of food, and they're invited to visit the Buff Pantry to receive food on a weekly basis at no cost. Students receive approximately 20 pounds of food and are able to visit the Buff Pantry one time per week. In addition, our Office of Financial Aid, as well as the Division of Student Affairs, have partnered on a student emergency fund. We look forward to sharing more about this, but at this time, we'd really like to open it up for Q&A. If you have a question, please feel free to enter it into the Q&A function at the bottom of your screen. We are prioritizing questions from students and family members, and we do hope to get to as many as possible today. All right, with that said, our first question is going to be directed at Jeff or Trina. Why does the order for the 37 residences still require them to exercise a loan?
Go ahead, Trina.
The 37 residences are under stay-at-home orders, so that is in alignment with the stay-at-home guidance.
Thank you. So Pat, this next question is for you. Thank you for providing 600 tests per day for off-campus students, staff, and faculty. Why not use some of these tests to actually require the fraternities and sororities to be tested weekly?
That is something that we're actually exploring with our partners in the county. The fraternities and the sororities they're off of campus, and that we need to make sure that we're addressing the overall off-campus community. But one of the things we know is that the fraternities and the sororities have had a higher rate of incidence. And so we're going to be expanding the additional capacity in a way that allows us to be able to get better monitoring of what's going on within that community. That's not only good from a public health standpoint for awareness, but we hope that if we are able to do that and put that type of program into place, that will serve as an additional early warning radar system for community health. If we see a rise in the incidence that's popping up in our surveillance testing, that lets us know that we'll have a potential outbreak and we'll be able to respond quicker. So with the testing protocols, we've learned a lot as the semester has gone on, but what we're really trying to do now is learn from our most recent experiences and trying to employ those resources in a very mindful manner to make sure that if there are outbreaks, we can get on top of them quicker and avoid having the rise of infection in the way that we saw over the past months.
Thank you. This next question could be directed at Dan Jones or possibly Jeff. We'll start with Dan. Why are the positivity rates no longer showing up on the CU COVID dashboard?
So presently what we're showing is the breakout between the different types of tests. And you can see the positivity in terms of looking at the different rates. I'm not certain we've actually ever had the positivity rates on the campus dashboard, but that's something that, you know, as part of making sure we're in alignment with the county on their dashboard, that's something we're continuing to look at as we get better at pulling the data together amongst all the agencies that are involved in this. Jeff, do you have anything to add?
The only thing I would add, Dan, is that the electronic lab reporting is now being integrated into the data from CU is now being integrated into that, and that is showing up now in our positivity reports as well, and that is something that we've worked on with CU over the last month or so. So appreciate all the effort there.
Can I follow up on that real quick, Jennifer? Which is one of the things that Jeff and I have talked about and that our teams are talking about is how we make the best use of data. And so that currently there is a data group that is working both with the city, the county, and with CU to try to make sure that we're using consistent sources of data, that we're looking at it the same way, and that we're going to be able to more accurately integrate our reporting. I know that that's been a subject of frustration for several people who have been trying to look at the different websites, including CDPHEs, and say, how do I make sense of all this? We're actively working on that, not just to be able to provide better communication to all of the people in the community and on the campus, but that ultimately having that type of information and having everybody working from the same playbook will allow us to be able to make more effective public health decisions for the community as well.
Thank you. So this next question, I think we're going to stick with Jeff and Trina. What are the metrics for lifting the orders, and have they changed?
Trina, do you want to take a shot at that and I can add?
Sure. So I think the question is, what are the metrics for lifting our local public health order? That is something that we're considering right now, and we're developing a metric scheme that basically is like the state dial, except on a local level, so that we would gradually lift restrictions and allow for more opening as the metrics allow.
Jeff, did you want to add anything to that?
The only other thing I would add is that part of the measures that we're looking at are incidence rates among the 18 to 22-year-old population, very similar to how we structured the existing order, and tracking what that incidence rate looks like as it relates to decreasing numbers. As we shared earlier, those are looking very positive at this point, but that will be part of that conversation.
Just to round out the conversation, there also was the stay-at-home order directed at the 37 residences, and we are not aware of any violations as of right now with respect to those residences, so we are looking at lifting those restrictions as well, or modifying them.
Thank you for that. Very helpful information.
And Jennifer, just one thing there, and Jeff and Trina may want to comment on this as well, which is that the numbers related to the infection rates and the positivity are really important, and we're going to look at that in the 18 to 22-year-old population, I understand. But one of the things we're also going to be paying very close attention to is whether or not we are seeing evidence of violations of public health orders if those big gatherings start up again, if we're having people who are not paying attention to isolation and quarantine, because those are the type of behaviors that really give rise to the increase in positivity rate, give rise to the increase in infection. And so we're going to be, at least here at CU, watching those carefully, because those, even before somebody shows up positive, if we start seeing those type of behaviors, then that means that we're probably going to have challenges ahead.
Yeah, and I can actually add a little bit more to that because I think it's so important. So we don't just look at the case counts and the positivity rates, but also all the things that Pat just mentioned. Plus, we're also looking at, are people seeking out testing? That's an important component of this too. We want people to get tested.
And Trina, that's such a great segue into our next question. And Jeff, it's directed at either you or I, so I'll let you go first. When will testing of well kids stop?
Thanks, Jennifer. We are encouraging testing of all students, and that's because we still are seeing a fairly large proportion of students that are asymptomatic. So we can't just rely on symptoms to assure that we're catching positives. And part of a successful program and not spreading disease is knowing if somebody's positive or not. So we do want to continue to encourage testing of all students. Really appreciate, again, the university's commitment to not only test on-campus students, but also to expand that to off-campus.
Perfect, thank you. Provost Moore or Pat, can you all share when we will announce plans for the spring semester? So Provost Moore?
Yeah, thank you, Jennifer. We're discussing that as we speak, and we hope to be able to announce the format and the academic calendar later this month, hopefully middle of the month.
Thank you. Catherine Irwin, if you are able to join, I think this next question is directed at you. What will happen to frontline workers, dining staff, custodial, trades, etc., in the time frame when students go home November 25th and return for the spring semester? That's one part. The second part is, will there be reduction in hours and or furloughs?
So normally during the break that we have between end of fall semester and beginning of spring semester, these employees are involved in getting the campus ready for next semester. So as you can imagine, particularly this year, having those extra couple of weeks will actually benefit these employees and being able to really and benefit the students coming back and being able to get the dorms and everything up and ready for spring. So no, we are not anticipating at this time furloughs, layoffs, or anything like that for this population.
Thank you.
You're welcome.
Jeff and Trina, I'm going to direct the next question to you. My daughter was denied care for her back due to public health telling businesses to not serve students. Why are all students being treated with such restrictions instead of limited groups?
I can take a shot at that, and then I'll ask Trina to clarify. So our order we would not prohibit students from using businesses, and students under the order right now, if they're not in one of the stay-at-home properties, they can go 2 persons to a business, as an example, together. We have not directed businesses not to serve students. We would not be sending that message out. So that, I'm not sure which business it was. It looks like it might have been associated with healthcare, but we are not directing that to happen. And Trina, I'll just defer to see if there's anything else you'd like to add to that.
That's correct. We specifically actually told businesses that we are not asking them to refuse service. The goal here is to allow students to go and obtain services at businesses, but in a safe manner, either individually or with one other person. So I can't address the exact circumstances of this person's daughter. I'm sorry to hear that. I can imagine that there might be situations in which someone might be COVID positive, that would raise a concern for a student. We do ask that COVID positive people stay in isolation, which means that they stay in their house.
Just a clarification there, Trina, that even if somebody was within stay-at-home status, they are still able to access medical care and to be able to do that. So it shouldn't be under any circumstances that anyone in the community, whether student or otherwise, wouldn't be able to receive healthcare services during this period of time.
That's correct, Pat. And I just want to even put a finer point on that. Even if you are under stay-at-home orders, you may go out for medical care, whether or not it's related to COVID or some other condition. Any form of medical care you are allowed to seek under a stay-at-home order. We don't want to discourage people from seeking medical care for pre-existing needs or needs unrelated to COVID.
Jeff, I think this next question is going to be for you and possibly me. How is CU Boulder and Boulder County using contact tracing?
So we developed a collaborative relationship months ago before students came back. And contact tracing has been set up through the university in conjunction with our staff. So they're working closely together so that students who are on campus are being followed up by CU, and again, in collaboration with us and Boulder County Public Health. And again, I appreciate not every university has done this with their local public health agency. So I appreciate the proactive approach that CU has taken on this, and it helps us as a public health agency locally to be able to then handle cases that come up associated with outbreaks like this.
Jeff, if I may speak on that contact tracing point, because there's been some confusion about how contact tracing is used. Contact tracing is used specifically to track where the disease is going. We do not use it to determine if someone was violating a public health order. So it's really, really important that students assist with the contact tracing efforts, because we're really trying to get at containment of the disease. And if you happened to contract that at an event that could have been a violation of public health order, the contact tracers don't look at that. They're purely concerned with where is this disease spreading, and let's try and contain that through this contact tracing process.
Pat, would you like to add something?
Yeah, one follow-up on that, which is that one of the things that the expectations that we have for our CU students is that they actually participate in that contact tracing. It's really important not just to be able to use it as a public health tool, but it ultimately serves as a way to try to be able to protect others within the community. And we've heard some stories of students not wanting to participate in contact tracing because they thought that they might get in trouble. We do have really what is an amnesty program for people who engage in contact tracing, so that they can do that without fear of being in trouble, getting reported. It's crucial for us to be able to succeed that people do this, because we've spent the time building the capacity that Jeff mentioned with the county, because this is one of our most effective tools. Testing tells us who is infected. Contact tracing allows us to potentially get ahead of the disease. And so anything that people can do to assist with that process, please do it and jump in with both feet so that we can get it right.
Thank you. So this next question is, are there any plans for the health clinic on campus to be open 7 days a week? And I can take that question as someone who oversees medical services. We are looking at ways to have our clinic physically open 7 days a week. Currently, we are not open on Saturday and Sunday. And for some of the students and families in the room, we used to be open on Saturdays and for many years. And what we found were a lack of students engaging in person on those days. I think that COVID-19 has illuminated some needs for us. So until we look at a 7 day a week option, one thing I would share is we do offer telehealth as well as 24/7 nurse lines. So no matter when we're closed, students can access services. This next question is directed at Jeff or Sarah. So Sarah Huntley, how will you ensure that CU students are not the only ones held accountable for Boulder COVID cases?
I am happy to take that. And again, this is Jeff. So what we do is we look at cases across the spectrum. So we're looking at all age groups. We know what kind of increases there are in different age groups. The reason that there was such a focus on the university students is because when you look at our graphs, and these are available on our website, you can see a huge spike in students. And that's why the focus is on the 18 to 22-year-olds, because we could tell that that's where the spike was coming from. That is what was putting us at risk in our community. And that is why the focus was there to control the spread of that disease, to bring it back down to the levels that we were previously at. So that's why the strong focus, but we're looking at all that data in all those categories and have been since the very beginning of this. And we do have those graphs again on our website.
I would just add that from the city's perspective, we're looking at the 18 to 22-year-old age group as one group of individuals, whether they're CU students or not. So our officers have been instructed that when they're out doing regular patrols throughout the entire city, if they see 18 to 22-year-olds in violation of the public health order, they are to be issuing citations. The one extra step they take when it is a CU student or somebody affiliated with the campus is we do refer that information to CU so that the individual can be spoken with, and also they can use their code of conduct evaluation process for that individual. But other than that, our police officers are treating all 18 to 22-year-olds, given the health data that we have, as folks that they need to be paying special attention to right now.
Thank you, Sarah and Jeff. For our next question, we'll direct this to Dan Jones and Jeff. What are the positivity rates per 100,000 for students on campus and for students off campus?
So I will start with that. As Pat had said earlier, we've got a group as part of the Joint Incident Command that's getting better information to make sure that we really provide better information in terms of CU affiliates. So today, I don't have that breakout for you, but that's something that we're working on. Jeff, do you want to add to that?
No, I don't have anything to add.
Thank you. Provost Moore or Catherine Egger, do the students have the option for their grades to be pass-fail this semester?
Yes, they do have the option. Excuse me. Yes, they do have the option to take pass-fail grades this semester. Last academic year, we actually extended the deadline for declaring pass-fail from the 3rd week of the semester to the 10th week of the semester. But I can tell you that we're currently in conversations with the deans, department chairs, and others to determine whether or not we are going to further extend the deadline for declaring pass-fail. We will make that decision very shortly.
Provost Moore, before you go, can you answer the next question for us? Will in-person classes resume tomorrow?
No, they will not resume tomorrow. We're working with our county partners to determine how we might ease off of the current public health order restrictions. And based on that guidance, I think folks on campus can anticipate an announcement regarding the timeline by which we would return to in-person activities on campus. But again, this has to be done in partnership with our county public health officials and working with the folks on campus to provide ample time and opportunity for us to resume those operations.
Thank you. Pat, this next question is directed at you. How do the case rates at CU compare to other similar sized universities?
That is, it depends. And I hate to give a wishy-washy answer, that when you look at campuses that are similar to ours, such as University of Madison, Wisconsin, University of Illinois, University of Arizona, some of those have also had some fairly significant outbreaks. There's been other campuses that have been less affected. There was an article today that reported that CSU has a lower case rate than CU does. And so in the state, what we've seen is that our infectivity rate over the last several weeks was much higher than it was on other campuses. That's part of the community in which we live. It's the nature of the residential experience that we provide. Overall, our strategies and our incidence rates are not dissimilar from what a lot of similar schools like Boulder would have. So it's within the range, and we've actually had a conversation yesterday with one of the epidemiologists at Boulder County Public Health who said a lot of the things that we did, including being able to have the surveillance testing, being able to have the contact tracing, enabled us to not have it be worse than it was. I don't want to pretend that the numbers are good and that this is where we wanted to be. But I think we have some responsible that we've acted responsibly in trying to be able to address this as quickly as we can.
Thank you. Jeff or Dan Jones, to your knowledge, has there been any students hospitalized due to COVID-19?
First I'll go to, I think Chana is on the phone, and I think Chana probably has the latest information about what we've seen in terms of hospitalizations specifically associated with students.
As far as I know, there's been only one case of a person affiliated with CU has been hospitalized to date. That's probably about a week old, but I haven't heard of any others.
Yeah, I don't have anything else to add other than based on what Chana had said.
Thank you both. This question is directed at Pat or Russ or Provost Moore. Can lab classes please resume since no positives have been traced to the CU classroom?
I'll take that one. That's pretty much the same answer that I gave moments ago. We do believe, we're optimistic that live classes can resume. Again, though, we have to be very careful on how we resume those classes, and we'll do so with guidance from our epidemiologists and our county partners to make sure that when we do resume, and that's a statement of optimism, when we do resume in-person experiences, that we do so in the most responsible way.
Can I jump in there too, Jennifer? Which is that in the conversations that we've had with the folks at Boulder County Public Health, I think that they've recognized that the classroom environment itself has been a safe place to be. In the classrooms, people have been wearing their masks. We've got the filtration and ventilation systems that are in place for social distancing. What we need to remember is as we go back into those type of instructional environments, it creates the opportunity for people to interact and engage in ways outside of the classroom that could be a problem. So we want to make sure that even when we return to in-person instruction, that people are paying close attention to what they do, that they're still wearing their masks when they're not in the classroom, that they're not putting together gatherings of people in a way that could be risky, that they're still following that social distancing, because the classroom itself is safe, but we want the entire campus to be safe. And in order to do that, you have to be mindful of what to do both in and outside of the classroom. And so we want to make sure, as Provost Moore was just describing, that as we return to more in-person experiences, that we're taking the good practices in the classroom and observing them outside of the classroom too.
Thank you. This next question is a two-part question that I'll share the beginning and have Dan Jones join me maybe for the second part. But Jennifer, can you please provide examples of outdoor activities that students can do? Is CU offering any support or events in person in an outdoor setting instead of online? So I'll share just a few things that we're doing in the virtual environment and then speak or have Dan speak to events. But right now it's so important that our students continue to follow those public health orders. And so many of our students are going on a walk, are doing outdoor activities that can be done by themselves or maybe with one person. One of the things that we often see is our students jogging, walking, biking, paying special attention to the fit court outside the rec center, and doing other activities that are really limited in interaction. However, there is a lot of need and engagement online right now and then supplemented in person. So some of the things that we're trying to do is to engage students in activities, whether that's trivia or hands-on crafts or other things where it can be delivered to the student on their residential hall or in a certain area of campus, and then they're able to go online and build that community together. At this time, no events or gatherings are being allowed at CU Boulder, but I'll have Dan Jones speak to that a bit more.
Correct, Jennifer. At this point, we're not allowing events. Any change in that will be done in coordination with the county as any of the public health orders adjust, and we'll make those changes really to make sure that we're continuing to protect the campus and make sure that we continue to have a contained approach.
Thank you. Jeff, a frequent question that we're seeing in the chat, and I believe you spoke a little bit earlier about it, is when will the county announce any changes to the order?
Thanks, Jennifer. We would be announcing changes to the order after our Board of Health meeting on Wednesday. So it would not be until later afternoon on Wednesday. And we can't obviously get ahead of the Board of Health's decision on this. So that is why we don't have final answers at this point. I can tell you, we have been working very closely between CDPHE, the University of Colorado, and the City of Boulder to really think about and structure any changes coming forth to the order and to the mitigation plan that is based on what we're seeing in terms of what you've heard people already mention. So behaviors that we're seeing up on the hill off campus, as example, what we're seeing happen on campus, what the rates look like. So there's a whole host of things that are factoring into what that final, what the final changes might look like.
And Pat, can I direct the next question to you? We're seeing lots of questions around our timeline at CU Boulder for upcoming announcements. Is there anything you'd like to share or add regarding when students could or could not go back to class or even resume activities?
So what we anticipate is, first we have to respect the ability of the Boulder County Public Health Board to be able to make the decisions that it needs to make about the lessening of the order. And I'm greatly appreciative that they talk to us, but we recognize that those are decisions that are the county's to make. Once the county has made those decisions on Wednesday and we fully understand what the guidance that we're going to receive from the board is, then we'll be in a position later this week to be able to say, this is what the impact of those decisions means for us, and be able to provide a clear timeline for when we might be able to have people return to classes, what type of activities would be permitted under the new health order, and how we can resume those. What we know is that it will take some transition time. Our faculty have done really tremendous work in being first in person and then remote. And to be able to move back to in person, we're going to need a little bit of transition time there. And so the timeline that we announce will have to account for that so that we can make sure that the educational experience remains good. But we're really on a pathway this week to be able to communicate that with our community.
Thank you for sharing that. This next question is about food options. I've heard that the food options are not healthy. What is being done to provide more on-campus healthy options versus having students buying off-campus food? I can take that question, but anyone who is interested, feel free to chime in. One thing I can say about the food options currently being offered to students, both on campus and through isolation, is we have a well-balanced plan. There are nutritionists, there are special needs, there are dietary needs that can be captured if the students are interested in sharing that information with us. And we do have teams within dining services that can meet with students to adapt or modify based on what is offered. A variety of options, and I know For many students, the Life app has been really helpful. It allows for more grab and go, but there's also lots of different offerings throughout the campus, whether that be through their lunch money or, their Buff One card, or through the dining halls. This next question is for Pat. Is the football team beginning to practice?
So the football team is not beginning to practice. What we have done throughout the course of this is the football team players have been doing individual workouts where they're working with no other players in groups. They're doing things like conditioning, they're doing weightlifting, but there's no player-to-player contact, and that they're working only with coaches on an individual basis. So there's no group activities or practice that is currently allowed under the order, because that would violate the prohibition on gatherings. But there are players who are reporting over to, and this is not just for football, but for other sports as well, over to the champion center so that they are able to do weight training and do conditioning. But that's an individual workout, not a group workout.
This next question is also directed towards you, Pat, and possibly Sarah. Is there a plan to help avoid the virus spread by testing for fraternities and sororities?
So I talked a little bit about that earlier, which is that we've increased our capacity for off-campus testing. One of the things that we're talking about with Boulder County Public Health is what a testing regime could look like for those types of houses that are located off campus, that have previously been under the stay-at-home order. One of the interesting factors is that for students in those environments who have already tested positive, it doesn't do much good to test them over the next 90 days because they've already got the ability to show up positive in those tests, even if they're not infectious. So we really do need to come up with the right type of plan that allows us to have that testing as an early warning system. And we've got to figure out what the logistics of that are in the next few days.
I think that Pat is obviously best equipped to talk about the testing, but I will say that we have learned during this process that we have some improvements to do with outreach to residents who are in fraternities and sororities. The city recognizes that these students are residents of the City of Boulder and might need a little extra guidance. So we are assembling a group that will be led by our neighborhood liaison, Brenda Rittenauer, working very closely with CU partners and public health partners to come up with an outreach plan to help sorority and fraternity residents understand the next steps as they will apply to them.
Very helpful information. This next question is directed towards Jeff. When you evaluate health orders, do you take into consideration students' mental health?
Yes, we are absolutely aware and have seen indications throughout this disease that there is mental health impacts. It is data that I talked about early on when I addressed my opening comments. And we also know that there's a balance. So when we have an escalation of cases like this, I think I've articulated a few times now what kind of impacts that can have, not just on our society, individuals in our society, but also we have 80 people who deceased in Boulder County because of this disease. And if we don't control the spread of the disease, we know it can have multiple negative impacts. So there's no good answer on this one because the disease is going to leave lasting marks on us for a long time. But we do have a responsibility to control the spread of it and assure that it doesn't impact large numbers of people, large sections of our population, and have more severe effects than it's already having at this point.
Thank you. Jeff and Trina, I'm going to direct this next question to you. Can you explain the decision to continue with K-12 Boulder students in-person classes and sports while the 18 to 22-year-olds are quarantined.
Sorry, can you repeat it once more? I didn't hear the very first part of that.
No problem. Can you explain more the decision to continue with K through 12 Boulder students in-person classes and sports while the 18 to 22-year-olds are quarantined?
Absolutely. Thank you for the question. So we've been looking really closely at data, and it's been a commitment of local public health directors across the state, as well as the state health department and the governor's office and others, to get K through 12 students back to school. It's really important. If you think about the impacts on parents, on kids themselves, especially at the younger ages, how important it is to have in-person instruction is critical. We also know from the data that we've been evaluating since the beginning of COVID and the data that we continue to get, that there's less chance of spread in the younger populations, which is why, as an example, you see Boulder coming back with K through 2. And we know that that's critical. We know it's critical because parents can't go to work if they can't get their kids into school. So it has been a very important goal that we've put as a high priority. The data that we've looked at for other school districts as well. So if you look at Cherry Creek as an example, they've been doing a lot of research on the quarantines they've had to do and if there's any secondary spread occurring with those young kids, and there's almost none. So we're not seeing the same transmission rates that we were seeing, as an example, in this population at CU. And we are still, though, we'll be watching that really closely. And the reason that we, again, want to make sure we have this outbreak under control is because it can affect and impact the K through 12 population going back to school as well.
Thank you. Provost Moore, can I direct the next question to you? When will advisors be in contact with students for planning courses for the spring semester?
I anticipate that will begin to happen this month. This month, and certainly mid-October and through November and December. And I'll actually kick this over to Catherine Eggert to see if she has anything she wants to add.
Nothing to add at this time. We have campus leaders and deans working on all of these issues together, and we will be getting announcements out as soon as we can. Thank you.
All right. And the last question looks like it's directed towards me, or I can help answer it. How can students get a flu shot? Students can sign up for a flu shot appointment in their MyCU Health portal, or they can come by Wardenburg Health Center and main campus, or they can call our main line and get that scheduled. And we've been doing flu shots all for the past 3 or 4 weeks, and they're very popular. So please get your flu shot as soon as you can. Looking at the time, and we want to thank everyone who has called in, who's participated, who's asked a question today. If you have further questions, please visit colorado.edu/COVID-19. We provide twice a week updates, 10 a.m. on Thursdays with the city and county, as well as Tuesdays at noon. We also would love your feedback. Please feel free to provide that at that COVID-19 website. There's a chat at the bottom. There's a who to contact box at the lower left of the page with an ask a question box as well. We really appreciate you all joining today. And at this time, we're going to end the call. Thank you.